Hi there, welcome to In the Clinic Before and Afters. I'm Dr. David Jack and I'm a cosmetic doctor working in London. So we're all very aware that cosmetic things can go wrong. In this episode I meet Kim, who's had some fillers done elsewhere, and we're going to explore how we can repair some of the damage that can be done by badly done fillers.
My name's Kim, I'm 55, I teach yoga and I have a lifestyle yoga company selling nice biodegradable natural products. I'm obviously getting older, gone through menopause, which I found created a lot of sagginess in the skin. I had a little filler put in my cheeks and I had a problem.
Kim, you were going to come and see me about some fillers, but then something happened. So
something happened. It was pretty bad. I had gone and had a little filler put in my cheek for the first time. I'd not had anything done before, and so I wanted to come see you to talk about rejuvenation, aging things that are happening in my face and neck area and hands. But then I had a problem.
Yeah.
The filler got infected just on the one side. Yeah. I mean, obviously I was freaking out. I ended up in the hospital.
Crikey.
And on IV antibiotics. My face had really swollen up and pretty bad. And they operated, so they've cut up inside my mouth, gone in and removed the filler and the infection.
Tell me, that was the first time that you'd ever had filler?
Absolutely,
before?
Okay. So it's kind of scared me.
Because I think increasingly in this industry that we're finding that there are a lot of issues with not necessarily infection, but more kind of poor quality fillers being used, so creating lumpiness and asymmetry and all of these sort of things, and also being injected into the wrong areas, the wrong techniques being used, because people are generally, I mean, they can do a day course in doing fillers and then basically be qualified to use them. So pretty terrifying. I think that your case is an example of why it's super important to
you do your research, meet the people.
Absolutely.
And I've kind of been left. I know it's just happened recently, but it's still a little bit numb, the nerve still not functioning properly. There's a dent in my face. I'm a bit worried about what's going to happen now, if that can be corrected.
The most sensible thing to do is that you probably have this lymphatic drainage massage today. Hopefully reduce some of the swelling that you have in the face there that's left over. Once you're back and you've had a chance to relax and recover and everything, we can then maybe start to think about some of these other issues that you mentioned. So
great.
How does that sound?
Yeah, I think that sounds good.
Kim unfortunately developed an infection after the filler, which then resulted in her having to undergo surgery to remove the infected tissue and filler through her mouth, which has been quite a traumatic experience for her. So I think the best thing for cases like this that have had fillers done either sort of inappropriately or incorrectly, that everything is left to settle for a while. And what I was planning to do with her is let her have some lymphatic massage just to drain some of the excess tissue fluid that's still there as a result of the infection, and then we'll revisit the area in a couple of months' time.
I had the face massage, which was like the lymphatic drainage, which really helped and reduced a lot of the swelling that was around. And then I went away. So I went into nature and obviously we had to work, but it was very healing. And so it's been 2 months. And as you could see, the swelling has reduced. It's not as painful. It's still healing, there's still a little sort of touch here, and I've been left with a big indent in my face here, the big indentation. So I'm feeling better about everything, but although I still am a little bit disfigured. So looking forward to see what Dr. Jack says and continuing on with treatment.
So tell me how you're feeling about it now and the way your face is looking?
I'm less panicky now,
Sure,
obviously, because that whole situation was like, I think I just was in shock. I was able to kind of be a bit more realistic about what was going on, and it's been healing.
Sure.
The pain has subsided, but it's still,
Yeah.
I could still feel the nerves tingling up
sure,
here.
yeah,
There's still, it's a wee bit lumpy, and it's still tender to touch. And this, obviously, this indentation is kind of deforming, it's flattened my face.
Yeah. Okay. Okay, do you mind if I just have a wee feel there? Just, so it's much flatter than that side. Yeah, you can see that there's quite a good lack of volume there. Also a little bit of scar tissue and a little bit of redness on the skin as well. So I think, I mean, probably the option at this stage would be to consider adding a bit of volume there very, very carefully, with a very tiny, tiny volume of filler. I would say, I think that the difference from one side to the other is quite clear. So I think if it were me, then probably what I would want to do for myself is to kind of balance things out a bit, because it does look like there is that groove there.
I'm not comfortable kind of in front of people. I'm not comfortable like talking. I mean, I know it's vanity, but it's like making me self-conscious. Sure.
Yeah. What you need to think about is just to balance whether or not it's worth doing something about the indentation that's left there, or just leaving it, and it's entirely your decision to make. I don't want to make that for you. So,
yeah, I'm trying to kind of enhance everything and look like more refreshed, and this is just completely created a whole different look. I wouldn't be comfortable with just this. I would have to do something about this. I can't leave my face looking like that. There
really would be, I guess, two main options for you with this: filler, or doing something more surgical like a fat transfer procedure. There's obviously less risk of the filler complications with fat transfer. However, there are drawbacks to that as well. There's risk that the fat doesn't take, there's risk that the fat breaks down, and there's a lot more downtime with it as a surgical procedure. But filler, as long as it's done kind of very carefully, I think, in building things up very, very gradually to get to a stage that you're happy with, would be, in my mind, it's a slightly safer option. Whether or not you want to kind of think about it for a little while, that's a different story. But I think that, giving it time is never a bad thing.
But also, obviously, the other concerns that I'm having is like the aging. And I was saying about menopause has really kind of affected a lot of things, and this whole getting old is not fun. So what would you recommend then for like the neck and the décolletage? It's like all these little red spider veins
and things. Spider nevi.
Crinkly.
Let me just have a wee feel if that's okay. So you got a bit of sun damage there. So you can see some of the brown marks and the redness as well. So I think that sort of thing, again, IPL to even out the skin tone might be quite a good idea there. For the crepiness of the skin, it depends if you want to go down an injectable route or if you would prefer to do a kind of laser type thing. Injectables, there's one injectable called Profilo, which kind of hydrates the skin and stimulates collagen. It's very nice for that area and also for the neck. That could be something to consider. And then there's a resurfacing treatment that I do for that area called Morpheus 8 that can tighten the skin and cause some lifting and reduction of the deeper lines and things in that area. That involves creating tiny injuries in the skin, and then as your skin heals, it stimulates new collagen and new elastin. Something to consider maybe for that area. It depends how aggressive you want to be, and or if you want to kind of go more down an injectables route or more down a lasers route. So,
Yeah. Well, I mean, I would kind of leave that up to you because I'm not.
Sure.
Yeah, I don't.
Yeah, I think for me, I think probably the first phase would be to try some IPL to see if we can remove some of the brown marks and things. That actually by kind of evening the skin tone out a bit, that might be enough to kind of treat what's there. And then see how that is, and then maybe consider something more aggressive at a later stage.
Obviously, I'm a bit apprehensive, right?
Yeah.
I mean, with regards to thinking that there might be some scar tissue in here, how will that affect anything?
It should. I just really need to take that into consideration with the injections. I think that probably continuing with massage as well is an important way of reducing the effect of the scar tissue with regards to the filler. But I would just inject in a way that is, I mean, it's going to be deeper than the scar tissue, so onto the bone surface. So really kind of deep tissue augmentation. So hopefully it shouldn't affect it too much.
Right. Okay.
Okay.
Yeah.
Cool. Have a think about it and decide what to do.
Well, we have to do something, and
Sure.
I am here, and
Sure.
I think I better just maybe try a little. We
Okay.
could try a little bit and see.
We can do a little bit. Yeah. You sure? 100%.
Well, you know,
Yeah.
I'm a little nervous, but
Yeah.
that's to be expected,
Okay.
right?
Okay.
I mean,
yeah.
I have to.
Sure.
Yeah.
Okay. So we can just start off with one syringe, see how that is. You can always do more in say a couple of weeks or a month or something, and just build up very gradually, as I said. So what I'll do, I'll pop some numbing cream on. I'm going to cleanse the skin, and then we can do some just very tiny injections of filler just across the area, just to try to replace some of the volume that's been lost there. Okay.
Yeah.
Cool.
It's affected me a lot because psychologically there's this kind of block of not wanting to see people. I don't want to socialise, but I'm trying to get over myself and get over the ego. It's not that disfiguring, it's just noticeable, and for me obviously it's my face, so.
What I think Kim will notice over the next few days is she gets a bit more volumization from the filler. I don't think it'll be back to the same volume as the other cheek or the starting point that she started with before she did any filler. But I think that there will be a slight improvement, and what I'll do probably next time I see her is inject a bit more filler to try to very gradually approach that so that it looks very natural, rather than put a whole lot in at first and then she's again unhappy or there's issues with that. It has to be broken down. So a gradual approach is definitely the right way with this.
Wow, yeah. I can really see the difference. I mean, obviously it's red and probably a wee bit swollen, but wow. It's really reduced. Well, yeah, I could see. I feel a bit better, yeah. Okay, fingers crossed.
So it was good to see Kim again today. It just goes to show that fillers don't always work out the way that you want them to. It's really important to choose your practitioner carefully and to use a really good quality product. And even still, there is risks around with these things. So I would say that for Kim, we just wanted to make her feel a bit better today. That's why we did a little bit of Botox. But she really should leave the filler alone for a while, and we can reassess things in a couple of months down the line once everything is settled down.
I'm really happy that I found Dr. Jack, and he's been really with me all the way with this situation. So I can't recommend enough that you find a proper doctor that's compassionate and cares and will be with you regardless of what happens.
So if you enjoyed watching this today, then please subscribe to my channel, set the alerts bell for new videos, and leave any comments or queries that you want me to answer, and I'll try to get back to you as soon as I can.